10 COVID-19 patients remain at hospital. A total of 48 have been discharged and others have been moved to step-down facilities. In its 10 a.m. update on Friday, the Health Ministry said 11 more low-risk, stable patients were moved from the Couva Hospital to the Home of Football Wellness Center in Balmain, Couva. There are now 38 patients in total at that facility, with another 11 at the Sangre Grande facility. The number of confirmed cases remains at 115, and the number of samples sent to the Caribbean Public Health Agency, CARFA, for testing is 1,473. The death toll remains at 8. Meanwhile, at the ministry's virtual media conference, Health Minister Terence Dialsing commended efforts by the government to contain the spread of COVID-19. He said implementing border controls and suspending the cruise ship season greatly benefited this country.
If the government did not take that proactive measure to suspend the cruise ship season, I want the country to think about what would have happened if we had 3,000 visitors on a cruise ship, like the Diamond Princess, in Port of Spain, walking around Port of Spain, taking maxi taxis to go on sightsee Maracas, wherever. It would have been an unmitigated disaster for Trinidad and Tobago.
Minister Dialsing said government's proactive measures started before COVID-19 was declared a pandemic by the World Health Organization, the WHO. Now, staying at home as the measures to prevent the spread of COVID-19 requires could lead to boredom and needs to be managed. This from community clinical psychologist Peter Weller, who said that feeling stressed out and nervous at this time is expected because this is a pandemic and there's risk.
And of course, the relationships in the household will make a difference too. If there's conflict and stress in the relationship that pre-exists, then that might be exacerbated by what is going on. If you are confined in a small space, you have fewer options to even move around, etc. So that, again, is going to make a difference. So there can be some positive outcomes, but for many people, there's going to be various levels of stress. And that can be anywhere from a normal to a more pathological and dysfunctional.
Mr. Weller said if people are accustomed to socializing and don't like being alone, or if they are in a relationship of conflict at home, then stress will result.
From HIV, that when you're trying to get people to change behavior, and in that context, it was sexual behavior. You had to give them the information, they had to have the facts, and they had to feel at risk. And unfortunately in Trinidad, we've been blessed with a relatively low incidence and prevalence of the COVID-19. But the negative side of that is that people don't feel at risk. They're watching it on TV, but so many of us see TV and social media as a kind of reality show. We don't take it personally. So a lot of people are venturing out without fully understanding the facts of transmission and without personal.
He said at this time, among the solutions for those who may be experiencing still crazy feelings is for friends to engage them with positive peer pressure. Now, this involves no arguing, but rather talking with them to help them assess whether venturing out is really worthwhile or even worth the risk.